I think right from the start, from medical school on, when we got out of the book learning portion of it and got into the clinicals, you would start to seeing patients. And back then, at that stage of training, you would talk to patients and you would literally be with them for an hour and a half, doing a history and a physical and doing all the different things that you're supposed to do and that you're taught to do. And when you give a patient an opportunity to talk and have someone to listen to, it's very easy to find out what they're not happy about. So again, it's rare that you would have a patient come in and say, my systolic blood pressure is 160. What do I do? My finger stick they're in the 200s. What do I do? That's not really what they're complaining about. They come in and the doctor is really more concerned about those numbers. The patients are concerned with, the question. If you ask them a question, how do you feel? You better be ready for the answer, because the answer is not always going to be something as simple as, blood pressure high, I prescribe medicine, blood pressure better. It's not always like that. And for the most part, medicine, there's an art to practicing it. And you have to provide that level of service where you actually care about the answer. So if you ask somebody, how are you feeling? And they tell you, I'm feeling tired. Well, now you've opened up, Pandora's box, so to speak, and you have many different things that come up in your differential diagnosis. They're not going to come up to you and say, I'm tired because I have anemia and I need B12 injections. They're not doing the work for you. You have to listen to them and find out what's really bothering them and address all the major concerns that you're supposed to do: blood pressure, cholesterol, diabetes, all the things we mentioned, but also the things that they are concerned about as well.